Yeah, good morning, everyone. Very early morning in Hong Kong, and welcome to my poster presentation on the topic evaluation of the CAP knowledge, attitude, and practice of childbearing mothers in the coastal region of Bangladesh with regard to hygiene and the safety of food. The study is uh, collaboratively done with the help of Noakhali Science and Technology University, Department of Food Technology and Nutrition Science, and the Geography Department of Hong Kong Baptist University, as well as Daffodil University of Bangladesh and um, Save the Children, United Kingdom, and BRAC. So, without further delay, I would like to speak about three things today. First, why I choose the topic, and then who are my participant and the study findings. First of all, our study topic, as we know, knowledge, attitude, and practice of childbearing mothers. So we choose this topic because coastal region of Bangladesh is suffering many infectious diseases, especially vulnerable groups like children, young children, 0 to 2 years. So this can be need to address to checking the household food safety and hygiene scenario. Most of the time, household women, female member of the household, and Bangladeshi culture, they are responsible for maintaining the household food safety and hygiene practice. So as we know, to the literature that it's a global issue. Many parts of the world face this food safety and hygiene issues. And according to World Health Organization, 6 million people died every year, and nearly 1 in 10 feel sick after taking the contaminated food. And more than 33 million healthy life are lost as delays. So to see the things, we try to check the knowledge, the attitude, and the practice score of Bangladeshi coastal women or men responsible for maintaining the household. The methods here are taking is cross-sectional study, questionnaire-based study. So we develop knowledge, attitude, and practice-based questionnaire taking consideration of the World Health Organization and USAID's knowledge attitude practice guideline. And based on that, after taking proper consent from the household women and other family members, describing the study's goal and objectives, as well as we also take approval from appropriate authority like local government and Noakhali Science and Technology University Authority Board, as well as Hong Kong Baptist University. So after conducting the study, we input our data in SPSS software, and then we take many analyses, for example, descriptive analysis, and chi-square test and ANOVA test to see the relation of knowledge attitude and practice-based score with socio-demographic profile like mother's education level, mother's profession, or family members like father's involvement or father's income and other socio-demographic characteristics. So without further ado, I jump into the results. So we can see regarding knowledge, most of the women and household member has proper knowledge, and they're from the interview, they mentioned they're taking. So if we see in a manner that how much they are taking knowledge is in 90% of women know how to cook food and how to wash their hand, and then how to clean the utensils and how to dispose child wasters and how to make clean the household environment. But if we see the attitude and practice deeper down in the questions, we see some food women did not wash, they did not do they have some poor or unusual attitude and practice. So like they didn't think to wash the eggs before shattering, and most of the like 31% household with women and their family members didn't check the expiry dates of some processing foods, and they don't want to throw the food after 1 or 2 days delays. So some perishable foods and some meats and beefs and fish can be spoiled, but in the middle of contamination or spoil, they want to take it. So that is a poor habit, and that can create contaminated food and can create infectious disease to the family members, and especially children are very vulnerable to this practice. So further, if we see the ANOVA analysis, we can see the father education, salary, and family monthly income have better behavior and attitude. That on the CAP score basis, we can see in the table 1. So these things are positively related to the better CAP practice in the household. So if father involved in doing the practice and their education is higher, family member education is higher, their practice of attitude of food safety and hygiene is becoming higher. So to the person correlation test, we can see not see the significance result between knowledge, attitude, and practice, but attitude and practice and knowledge and practice have some inverse relationships. So this sort of studies also happen in many area, and many area have quite a good amount of knowledge regarding kitchen work and regarding the waste disposal and serving, hand washing before serving meals. But some women have a lack of cleanliness and food safety in terms of their attitude and practice regarding processing food and expiry date food and vice versa. So we can see in Ghana, India, and Nigeria similar study. But if the male member of the family education is higher and the income is higher, they show better knowledge, attitude, and practice towards food safety and hygiene. Checking food expiration date, utensil washing water, and cleansed egg before cracking, and the shells scored poorly. So, in conclusion, we find this study found that most of the women in Bangladesh coastal area came from low socioeconomic origins and have low education level. If the spouse helped maintaining children's cleanliness and family cleanliness, the knowledge, attitude, and practice improve. Mothers who handle food should be educated on regular basis, and food safety and cleanliness. Local government and the policymakers should implement proper education and intervention to improve the current food safety and hygiene situations that is prevailing now. And other family members' engagement, especially father engagement, should be prioritized to making this knowledge practice scenario better. So here is some references from the study, and thank you for listening my presentation.